Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleitner and I'm joined by Dr. Stephen Wrench of East West College of Natural Medicine, and we'll be discussing cold laser therapy. Right now, though, I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. Light amplification by stimulation of emitted radiation was proposed by Albert Einstein in 1917 and discovered in the 1960s by Bell Laboratories. In the late 60s, Dr. Endre Mester in Hungary tried using the laser to treat surgically implanted cancerous tumors in rats. While the treatments proved ineffective for the ablation of tumors, he soon discovered that the surgical incisions that he made healed much faster than normal. For the past 25 years, cold lasers have been used globally in the successful treatment of chronic and acute pain, slow healing wounds, and fractures.
Thanks, Russell, and we'll be checking back with you later when we see a demonstration of cold laser therapy. And right now, Dr. Wrench, though, we should start from the beginning here. What exactly is a laser?
Well, there are different kinds of lasers, but we'll go back to the beginning. The laser was first proposed by Albert Einstein, Grant, and actually as far back as 1917.
Wow.
But it wasn't until the 60s that Bell Laboratories researched and developed lasers as we know them today. Now, laser actually is a term that stands for light amplification through stimulation and emission of radiation. So basically, we know lasers from the TV shows and the movies when we see them.
Yeah, they have many uses, right?
They do. We have what we call a military industrial type laser that we won't really discuss today, but they're capable of cutting metal and they're weapons grade and so on. And then we have different kinds, like in eye surgery and ophthalmic surgery, they have what's called a YAG laser, and that's an yttrium aluminum garnet type laser that's used after cataracts are removed. It's used to kind of to improve vision.
To help the lens. And
we have them, they're used in dermatology. There's different kinds. The kind we'll be talking about today, though, is what we call LLLT, or low level laser therapy. It's called that because it's a cold laser. In other words, it doesn't produce heat. It's not going to cauterize flesh and so on. There are types of lasers. What we have a type called CO2 laser.
Okay.
It'll literally, in size, it'll cut flesh and it immediately cauterizes flesh.
So all in one motion, if you will.
Yes. So again, not the type we use as an adjunctive therapeutic device in Oriental medicine.
Now, you had mentioned this, but how long have they been around for this purpose? Several decades, it sounds like.
Well, really, the laser was developed in the 60s. But as a therapeutic medical device, it was in 1968 in Hungary. There was a doctor named Endre Mester, and he was one of the pioneers in medical research in terms of the use of a laser. And what he did was he took small tumors and implanted them in rodents, laboratory rats. And his thinking process was, well, we'll vaporize this tumor. And so what happened was he would apply the laser to this surgically implanted tumor. Now, remember, it's been stitched back up.
Right.
So what happens is, basically with the tumor, nothing happens. But interestingly, the incision that was made for the purpose of the implantation began to heal at a much greater rate than would normally occur. And you'll hear Dr. Fuller allude later in the program, I think, to the fact that lasers actually do affect wound healing.
They help with healing.
And the healing process in fractures, and this is interesting, in some fractures, depending on the age of the patient, the site of the fracture, the type of the fracture, the type of immobilization, the type of nutrition involved, and the absence or presence of infection, these are all healing factors. Depending on all those factors, we can aid in the healing of a fracture up to 60% faster.
And have these lasers been evolving since the 60s, getting more effective, more beneficial as we... It's like technology,
yes,
right?
Yes, they have. Yeah, absolutely. They have. And so in about the last 25 years, we've seen the emergence of lasers as adjunctive medical therapies. And they're used everywhere. And we've been using them at the college now for about the last 4 years.
Now, as far as, that was my next question, how long has this laser therapy been used as an adjunctive medical device? And at the college, it's been several years. And what types of, I guess, patients would qualify, or would you recommend this type of procedure too?
Well, because we see so much pain. You know, we see, and we've talked about this in past programs. For years, people go, oh, acupuncture treats pain. It actually treats anything. But because everybody has pain, I always say when I do one of our speaking engagements, anybody in the room that doesn't have pain, raise your hand. And usually no hands go up.
And no one goes.
So we all have pain. If not now, at some point we will. So it's certainly a very, very helpful device in the treatment of pain. And if I may, I'd like to tell you kind of how this works. When the laser, and we're going to just hold it up briefly and just show it to you. This is just a little handheld device, and I'll take the little collimator off of it and just show it. It kind of looks like a flashlight.
Yeah.
And it plugs in, and I'll actually put this on your hand or something later and let you won't feel it. You can't feel anything. But what happens with the laser light, and we now know this thanks to Andre Mester in '68 and years since in research, that when the light hits the cells, and we have 100 trillion, so there's plenty to go around.
Right.
Every one of those 100 trillion cells has a mitochondria within it, which we call the powerhouse of the cell. And for whatever the reason, the light excites the mitochondria. The mitochondria amps up its own energy and metabolism. And this speaks to 3 systems in the body. So it's kind of like every cell in the body kind of elbows the cell on either side of it and says, are you feeling this?
Right.
So we have a little mitochondria party. All the cells amp up, and they speak to 3 systems. Number 1, the vascular system. Well, when that happens, we create, or the laser creates vasodilation, meaning that the little vessels get bigger. And when they do, more blood comes to the area, and this super oxygenates the cell.
And
so it's a cycle.
That's beneficial, right?
Oh, absolutely. It's a productive cycle. Now it communicates with the lymphatic system, whose function is to get rid of the waste products and get that out of the area. And the third thing is it communicates directly with the central nervous system, as if to say, you're a little overexcited, need you to calm down. And so what happens is we slow or change or alter the inflammatory response. We get inflammation down. We superoxygenate. Blood brings the healing mechanism with it. And so pain goes down, range of motion may increase, quality of life goes up. What's not to like?
So lots of things happening, and don't go away. When we come back, more questions with Dr. Wrench, and then we'll go back to the college to see how cold laser therapy works up close.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back to Natural Healing with Oriental Medicine. I'm joined by Dr. Wrench, and we're talking about cold laser therapy. I want to go back to the lasers and whether there are different kinds. You touched on it, but let's go into some depth on that.
Okay, well, I'll speak more on the one that we brought today because that's the one that we use, but we talked about a YAG laser that's used like in ophthalmology.
Right.
We talked about the type that's used military industrial. We talked about the type that's used in surgical procedures because it'll cauterize flesh. As it makes an incision, it goes right along. This is called a CO2 laser.
What about those pointer lasers? Do those have any application here, or are those something completely different?
No, depending on the amount of output of that laser, one of the big things that we know about a laser, period, is number one, we have to be very, very careful about shining it in our eyes because it can damage your eyesight, destroy the retina. So we have to be very careful with that. That's one of the first things that students, when they
They learn the
about
safety.
the laser. Yeah, is number one. It's real simple, basically. Don't immerse it, don't drop it, and don't look at it. I always tell them that's rule number 1, 2, and 3. Rule number 4, obey rules 1, 2, and 3.
Yes.
But when we think about the type that we use, this is called a Class 3B laser. And that means it's none of the other types that we mentioned.
Right.
This is what we call the Microlight 830, or ML830 for the company that makes it.
And you see some warning signs on there. You see the danger.
Oh,
and
yes.
people know before they use the device that you're not. This is not a toy.
Oh no, you can feel it's very heavy actually for a small device. It is very heavy, and even though it looks
like a utility
just like a
flashlight,
it does. And I'll just plug this in, and I'm going to turn this on my lab coat. I don't know if the camera can pick up, but it's a little red glow there. We don't want to look at that,
right?
Because now it's activated. But this particular one is what we call an ML830, and it's a handheld direct connect, as you see, direct connect, meaning it can also directly contact the skin. It doesn't have to be held above the skin.
And like you said, this is cold. This is not heat.
No, it is. It's also called a direct connect, handheld, non-invasive, athermal, meaning no heat is produced. These, if I can, I don't know if we can pick this up on the camera or not, but at the front of this you'll see, and you can see it, and we're not going to turn this on while we point it at you certainly, but you see 3 little dots and then a little lens in the middle.
Right.
These are called gallium aluminum arsenide diodes. Each one of these produces 30 milliwatts of continuous wave laser energy operating at an 830 nanometer wavelength. Now that's technical garble for people, but that is what classifies this. If those numbers were different, this wouldn't be an ML830. It wouldn't be a laser.
And so once this is turned on, it penetrates the skin and gets down into the cells, or what happens?
Well, each one of these little arsenide diodes produces 1 joule of, that's a measurement of laser energy, or a bundle of energy. There are 3 diodes, so collectively we produce 3 joules, which makes it again a class 3 laser.
Right.
Now, they can penetrate up to 5 centimeters, give or take 2 inches, into soft tissue. So one thing to consider though, when we talked about using the laser for fractures, the problem with that is what happens when we get a fracture. If it's severe, you usually have a cast on it.
Right.
So that's why when I gave you all of the information about lasers, I said site, meaning where is the fracture?
Where
on the body, the type of fracture. Now, let's say that a fracture is it's a incomplete fracture, or non-displaced, we would say.
Yeah.
It means that the 2 ends of the bone, there may be a little crack, but the ends are connected still. It may be they don't cast this type of fracture, or a little stress fracture. So in that regard, we could then apply the laser. When we have a cast, it's a no-go. We cannot use the laser in that case. What we can do is use it after the cast comes off, and just kind of as an adjunct later. But by that time, generally, we have a pretty healthy and mended bone. So.
All right, so we're getting a good idea of how this laser works. So now let's go out to the East West College of Natural Medicine and see a demonstration with cold laser therapy up close.
So we're back here at the campus where we're going to demonstrate a laser therapy treatment. I'm here with Dr. Brandon Fuller and Amanda. Take it away.
Thanks, Russ. So here we'll be performing a laser therapy treatment. And as was stated before, laser therapy is used for slow healing fractures and slow healing wounds. So the use of this laser is as simple as pressing a button and every couple of seconds making a slight turn. Research has shown that the use of this laser helps penetrate the skin into a depth and travels along the channels or meridians, as we've said in the past. Now, the use of this laser could be used on different pathways, different channels, different meridians, even different acupuncture points. This laser specifically runs for about 30 seconds and then shuts off. So we have to do a continuous on-off sequence. right? And as you may be able to hear in the background, it beeps for about 30 seconds. There's no pain associated with this treatment. There's no presence other than it might feel a little cold to the touch, right? Because it is metal and touching your skin. One of the benefits with laser that was found years ago is that the use of this laser when rats had been shaved, then adding this laser onto a rat's skin helped increase the growth of hair, right? And it's quite amazing because those that were shaved and didn't get the laser, the hair growth was about 2 to 3 times slower than the rats that did get the laser. So this might be helpful and might be used on patients who've had chemo or somebody who has peripheral neuropathy and blood flow might not be flowing right where it needs to be. This can help coax the blood to flow down to the points where it needs to go, right? Especially if it's in the feet or in the hands. On a patient who's had chemotherapy, one of the side effects is that patients have this sensitivity to touch. And so when a patient doesn't want to be touched, sometimes acupuncture might not be the best choice or the best method, right? Whereas this laser is gentle, it's not painful, we can hold it and we can control how much it touches the skin. So the use of this laser on a chemo patient or somebody on medications who has pain just to the touch is highly beneficial. And then as the patient starts to recover from whatever condition's going on, we can go further with different modalities. This is one of the most beneficial tools in our toolbox for use of different problems such as that. One other condition that has been known is something like, say, stomach problems, or we've seen patients who've had skin conditions. This laser has been very beneficial because as the laser penetrates, it penetrates only to a certain depth. It doesn't go all the way through the body. So it helps bring that blood flow to areas where there might be a dermatological problem like eczema or psoriasis. And it helps this nutrition-filled blood flow to that area to help heal the area. Other research that's been done on a laser like this one has shown that it boosts the mitochondria in a cell. And the boost of a mitochondria is like boosting the powerhouse or souping up the engine in your car, right? So souping up the engine in the cells in the area are highly, highly beneficial. You can help heal faster, as we've said, or you can help bones that are stubborn and just won't heal. This is a great in conjunction therapy for acupuncture physicians here in Florida because we can add herbs, we can add acupuncture, we can add different injection therapies, we can do massage with it. It's a non-invasive therapy, which is great for just about every patient.
Very interesting. Thank you, Dr. Fuller, for that. And Dr. Wrench, so we saw the patient receiving this therapy. Did that person feel anything, or is it there's no pain involved you talked about?
Oh, no, absolutely not, Grant. In fact, only about 3% of people that have ever experienced a medical laser have ever said they felt anything. And if that wasn't painful, it would have been like a little tingle or a sensation like that, but nobody's ever said, oh, that hurt. Now, it is possible that with certain laser treatments that as we try to heal an area or help with the healing process, pain can get a little worse a day or two later, although I personally have never seen that.
At the origin of where the laser penetrated?
We have to mention that it's possible. When things heal, oftentimes you go through a healing crisis, although I wouldn't personally connect that to a laser.
Right.
We do see it. So let's
if I were going to get something like this, what would happen?
I would have you put on the dark glasses, and of course I'm
All right, I can do that.
I'm careful enough not to shine this in your eyes or mine either.
You're a professional.
Now you're in Hollywood.
So now we got.
Okay.
I'm being safe. So let's say I have carpal tunnel, and you're treating a patient. What would happen?
Well, we're going to just place this on and turn it on, and I don't think the camera picks it up, but maybe our mics pick it up. The little beep.
Yeah.
And as Dr. Fuller alluded to, we're going to rotate this so that each one of these little diodes.
I'm feeling just a very slight, nothing really there, but.
Well, if you had carpal tunnel, this is what we would call a neurovascular compromise, and it's caused by the pressing of what we call the carpal volar retinaculum is pressing on the median nerve. It's a little wordy.
Now, what would end up, how long would this take to treat a patient? Would you be doing this just for a few minutes at a time?
Probably
on each hand?
6 minutes the first time we do it. Now, a treatment can go up to 20 minutes.
Oh, I see.
But generally, we do is about 6 minutes, and we just kind of keep this moving around in the region. And it's putting out a little red light about the size of a dime.
And so
for those that cannot see
this
that
is
at
treating
home.
the cells that are affected by this and any other tissue that might be compromised, nerves.
Absolutely, and it's a non-invasive as you see. It's on the outside. And so it's a very painless thing.
Right.
So sometimes people that are a little squeamish about maybe acupuncture needles in this particular region, then this would be a nice.
This would be a supplement?
It would be an option for them, absolutely. Now, if we want to treat just a specific acupuncture point, we put on what's called a collimator. And it means now we can focus this to a little bit of a fine point. And in that case, treat a specific acupuncture point, like there's a point on the wrist that we call the carpal.
Now, are all three of them being concentrated into a bottleneck so it's more intense?
Absolutely. And now we're treating me here now. I don't have carpal tunnel, but you never know. So this is a way we can focus that beam of light into a very fine point, which we're doing so now with the application of the collimator.
All right, and don't go away. We'll be back with much more after this.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back. We've been discussing cold therapy, or cold laser therapy,
Correct.
I should say, and we saw the demonstration by Dr. Fuller. Dr. Wrench, I just want to kind of finalize all this now. We've seen the demo, so how long would a treatment take for a patient? And when you use the laser, is it just the laser, or are there other things involved?
Well, as far as the time goes, it would depend on what we're treating and where we're treating it, how long they've had the pain, what area of the body. If it was, let's say someone has pain all along their spine, and we say, where does it hurt? Oh, from my neck all the way down to my low back.
Right.
Obviously, that's going to take a whole lot of time. So generally, if it were something like your carpal tunnel that we acted like we were treating,
Yes.
it was maybe 6 minutes, maybe 10 minutes tops.
Okay.
So 6 to 10 minutes there. But again, in an area, a large area, a lot of musculature, a lot of bony structure along the spine, we're looking at maybe the full max, the 20 minutes.
And a particular patient, general patient, would probably get other treatments in addition to this? Would they be getting the whole regimen, maybe herbs and
Sure, and again,
acupuncture?
dependent upon certain factors that affect the success or lack of success in any treatment are to be considered first. Number one, how old is the patient? Number two, what is the problem that the patient's having? Number three, how severe is the problem that that patient's having? Number four, any intervention they've had that maybe isn't helping us. Like sometimes a person will say, well, I had an operation on my neck. And we go, how are you doing since the surgery? I'm actually a little worse. In some cases you hear that, in most cases you don't, but sometimes you will. Well, it's ever since I was good for a while, but now I'm having this issue. Because when you invade a human body, you kind of takes your chances a little bit.
Right.
So depending on what we're treating and all those other factors, but we would normally include acupuncture in most every treatment, laser as an adjunct, possibly the moxibustion, the cupping, the herbs, depends, the liniments, the plasters, all the other
things that
things.
we've talked about, sure. Now, as far as these lasers, I'm assuming that the best advice is to leave it up to a professional, but can people find these in retailers and online, and what is your approach to that?
Excuse me. Well, probably you can, but be very careful about that. Number one, you have to have some training, to a whole lot of training, depending on the type of laser and the use of that laser. Beware of people buying these things on the internet. They don't know what they have and don't understand the safety involved, safety procedures and precautions that need to be taken. Like we talked at one point today about the little keychain lasers and all that, and kids in school shining them at other kids. It's very dangerous because it can damage the retina. So this has to be, or these type of lasers need to be utilized by physicians.
Right.
And short of that, unless they're a trained therapist that also understands the usage, then I'd say stay away from it.
Okay, and is it expensive to receive these treatments, or is it just part of a regimen that you would set up for a patient? Is it?
There's an additional charge, but it's very, very minimal. At our clinic, I think a laser treatment in and of itself is $25. That would be tacked on to the cost of the rest of the treatment, depending on what we did and so on.
Now, joint pain, that's one of the qualifications. I was going to ask, because you talked about that, I was going to ask, is there any part of the body that you would stay away from? You talked about the eyes.
Yeah, specifically up here.
Yeah.
About as close as we get in our type of laser. Now, we talked about people having the dermatological lasers and the lasers for the eyes, like we talked about the YAG laser that is placed on the eye and so on. But that's a very, very specialized type and can't be used by anybody but a very, very highly skilled ophthalmic surgeon. But we work a lot in the neck region and so on, but we stay away from the face a lot.
So we're almost out of time. Let's let people know where they can get more information about the college, where they can find you.
Absolutely. Well, we're at East West College of Natural Medicine, been in Sarasota 20 years. We're down on the North Trail, and we're just right across from
Smuggler's Cove, just south of University a little bit, right on the main drag of 41 up there.
So if you're there and you get a little golfer's elbow, you just cross the street, we'll take care of you, or you can call us at 355-9080.
Good show, Dr. Wrench, and thanks for joining us. We'll see you next time.